Welcome to FinFactor. I'm your host, Blaine Bertsch, co-founder and CEO at Dry Run Cash Flow Forecasting Software, where we help the office of the CFO leave spreadsheets behind and model everything from cash flow through to complex scenarios with clarity and control. And joining me today is Donovan Pyle of Health Compass Consulting, where they work to eliminate the healthcare overpay that plagues employers across the United States. Today, we'll explore how CFOs can turn healthcare costs from a burden into an opportunity with up to 25% of employer healthcare spending wasted. We'll reveal where the money goes, how to find it, and how to reinvest those hidden profits back into the business. Welcome to the show, Donovan.
Great to be here. Thanks for having me.
So first off, I want to dive in. You talk about this, a significant portion of healthcare spending is wasted. Can you kind of break down where that waste kind of typically comes from and where CFOs should poke around and investigate in their own business?
Absolutely. So just to level set for everybody, U.S. businesses spent about $1.3 trillion on healthcare last year, covering 164 million Americans. And here's the opportunity. Like you said, 25% of that was complete waste. That's $325 billion. Or if you break it down to the employee level, that's $4,000 per employee per year. Completely unsustainable and completely unnecessary.
So how does the CFO know? I guess you're saying, okay, you're wasting likely 25%, and they go, okay, where? I don't even know where to start. Like where would they start to dig?
Yeah, it's a great question. So, this is according to the American Medical Association. They have the most conservative estimates, or that 25% is being wasted. And yeah, I mean, let's face it. The insurance industry has been masterful in lowering expectations amongst their customers to their financial benefits. Okay, I mean, think about it. CFOs and HR teams have been told for decades that, hey, healthcare costs just go up every year. Not a whole lot we can do about it other than, increase deductibles and narrow networks. It's totally false. And here's the thing. The whole system is designed to hide the price from you, right? I mean, what other market exists where you don't know the price of what you're buying? They masquerade it as if insurers actually take on risk, but in reality, if you understand the incentives, the regulatory environments, and the market conditions, they take on no risk. It's employers and patients that take on all the risk. They are the ones buying the hospitalizations, the surgeries, the labs, imaging, and drugs. And so, one of the steps I outline in my book, Fixing Healthcare, which it came out on November 12th, is that you have to put yourself in a position to see your supply chain. And then once you see it, then your hair is going to go on fire because you're going to say, why are we paying $4,000 for MRIs when we can pay $400 for the same things down the street? Why are we doing that? This is the massive opportunity that's hiding in plain sight, so long as you have the right guidance to help you leverage it.
So what are some of those key blind spots, like you mentioned? Because I understand a business, they can look and say, okay, yeah, that MRI should be a fraction of the cost, but how do I know what's plaguing us, and where do we even how do we even take that first step to figure out what to do about that?
Yeah, so let's talk about this. The first critical step is getting unbiased advice. Since most finance teams and HR teams have no technical experience or expertise in healthcare financing or procurement, about 81% of businesses rely on brokers for financial advice on how to maximize their investment. This is a critical mistake. And this is why I dedicated an entire chapter in my book to the history of this industry. The brokerage industry was never designed to help you maximize your investment. It was designed to serve as retail distribution for health insurers' products. They sell products. That's what they do, sell you products. They are not in the business of giving you financial advice on how to maximize your investment. Because they serve as retail distribution for insurers, and by proxy, hospitals and drug makers, they make more money when your costs go up, not down.
Yeah.
You have to understand that. And so, especially if you're using a top 20 legacy brokerage firm, they have this great euphemism for kickbacks. They call it market derived income. Look at their 10K earnings reports. They call it market derived income when they get these kickbacks from insurance companies and PBMs. And often it's
Mhm.
undisclosed to you, even though it's under federal law, you're supposed to know. So you can't expecting the fox to guard your hen house is unsustainable. And this is a key reason why employers are not shown how to actually buy healthcare effectively. It's an opportunity hiding in plain sight.
It's, oh boy, like, as soon as you say that, I can relate to it because every year I gotta look at my car insurance, my health insurance. I know, longtime good customer, the broker doesn't call me and say, "Hey, we think we can save you a little bit of money." It goes up every year for basically no reason until all I do is make a phone call and there's another salesperson on the other side. Suddenly I'm getting a deal. And
Yeah.
and that's obviously on a small scale. So when you look at a 300, 500, whatever $1 million business and the amount of money that they're spending, like $4,000 a year in per employee, um, it gets to be a really attractive area to reduce your costs.
100%. We got a call from a large teachers union in Seminole in Central Florida a few years ago. And they're like, listen, we've got our members. They're smart people, but they don't know this insurance stuff, and they're sitting on this insurance committee being asked to make decisions about this $65 million healthcare budget, and they're getting their asses
Mm,
kicked. I mean, they seriously. I mean, this plan was just being run into the ground, and so they said, listen, we don't, can you just tell us what we don't know? All right. Like,
mhm,
help us understand the landscape, who does what and why, and tell us what we should be pushing for in these committee meetings. So we did that, and we found out, of course, you alluded to the apathy in the current model, right? Unless you really press
mhm,
people, they just don't take action. And so we did an analysis of their plan, and we found out, hey, you guys, you haven't gone to a new RFP for a new pharmacy benefit manager in 7 years. And by the way,
mm.
you're using one of the worst ones. So just push for a new pharmacy benefit manager. They did that, and they saved about $3.6 million last year on drugs with
Wow.
no
That's,
no change management, virtually no change management involved. No, people are always concerned about what are the employees going to think. This is for their benefits. I mean,
mhm,
there's
yeah.
it's just unbelievable, and these opportunities are everywhere.
So you talk about, like, what is the first step? What's the first strategy? Like, I know you talk about doing an assessment. How do they
Yeah.
even do that? Where should they go first?
Okay, so I mean, let's just back up 1 second. Yeah. I'm going to answer your question. But the first step is getting unbiased advice. Okay, so how do you do that? Two ways. You can get unbiased advice by working with a fiduciary based management consulting firm who actually legally is obligated to serve in your best interest. Their job is to protect you from supply side vendors, not benefit from their fraud, waste, and abuse. Okay. Their job is to protect you, the employer, and your employees. And so what they're going to do is they're probably going to take, have a diagnostic process for identifying opportunities. Okay, so that's one way to get unbiased advice, and there's a growing number of these organizations emerging in the marketplace. Since 2015 or so, I started mine in 2018 after working on the carrier side of the business, after working at a legacy brokerage firm and seeing how screwed up all those things were. So there's a number of those emerging in the market. The other way that you can get unbiased advice, if you're a large organization, let's say you have at least 1,000 employees, bring benefits expertise in house. Find people that hold
Mhm.
the highest certifications in this business. They're registered employee benefits consultants. They're certified health value professionals. Hire them, put them on your payroll. The ROI, for a good one, can be somewhere around 30 to 1 in some cases, depending on, on
Yeah.
on the size of your organization. So get them on your payroll. All right. So once you've gotten unbiased advice, what's the next step? A diagnostic, assessment of how your organization is performing in the 7 key categories of benefits value. Uh, You know, y- Businesses use KPIs in all other parts of their business, but when it comes to health insurance and health plans, So many of them don't. And it's really a
Mhm.
mistake because how do you know if you're doing well, right? Leaders want to know this central question. Are we doing well, or is there an opportunity here that we should be pursuing? Should we pour,
Mhm.
energy and time into pursuing optimizing in this space? And so having a quantitative framework for assessing how you're performing in these 7 categories of value compared to your peers. Once you do that, then you can again identify opportunities, set goals, and develop roadmaps to achieve them. It's not rocket science. You just need the framework, and so that's a really key part of the overall services that are needed each year.
So moving forward from there, so they've done an assessment. They've got someone on their side, and they say, okay, we gotta make some changes here. And as always, as we're talking with CFOs, I'm sure the CFO when they see money, a chance to cut costs and say, hey, like we can actually improve services and cut costs here. Let's do this. Um, there's a lot of data now floating around an organization, especially when you're talking, you got 1,000 employees or whatever that is. How can they use data? How can they use analytics to understand what's happening and to be able to empower them moving forward?
Yeah, so data is very important, but if you're working with someone, if you're an advisor, again, once you've got unbiased advice and you've got someone who really understands this marketplace and understands the financial incentives of these legacy vendors and different vendors in the marketplace, here's the thing. I- if you're using vendors whose business model puts you in a situation where their financial interests are diametrically opposed to yours, you are always going to be pushing water uphill. And here's the good thing. Once you get unbiased advice, employers are shocked by this. They think the marketplace, there's like 4 vendors and you either go self-funded or you do fully insured. No. Once you get unbiased advice, you're going to see that the marketplace is huge. I mean, there are literally hundreds of PBMs competing for your business against the big 3. There are so many solutions out there, and it doesn't mean they're all right for you, but you can absolutely
Mhm.
use them as leverage in negotiations, and you should. Okay, so there are pick vendors who at least their business model aligns with your business objectives, right? You're not going to be pushing water uphill because hey, the PBM that we use, uh, you know, they're their services are free, but they just mark up the price of the drugs by undisclosed amounts that you'll never know. That doesn't work. It doesn't work. Find vendors who actually embrace fiduciary responsibility and serve as a fiduciary to you. That's a legal term in their contract. You need to know who those vendors are and take advantage of them.
So, what's the first step? If I'm the CFO and I'm hearing this, I'm thinking, yeah, I've seen those bills every year. There's got to be some waste in there. What's the very first step? Going back to, I know you've gone through a lot of this already, but what it's like today, what should I do to get started?
Okay, yeah. Today, so to get unbiased advice, which is the most critical step, this is the biggest constraint in the system. Is that people expect this, to use a metaphor, the CPA who gets paid by the IRS to lower their tax bill. That's the system that you're in right now. It doesn't work, as you've seen. Health insurance inflation, it's the fastest growing financial risk on corporate P&Ls, doesn't work. So, how do you get on where do you find these management consulting firms who actually specialize in this stuff? Well, one way to do it is to go to the Validation Institute's website. There's a list of them. Okay? And there's I think a couple dozen who do exactly this. They serve as a fiduciary to you to protect you from supply side vendors. That's their job. That's why these businesses exist. That's an easy thing to do. Now, full disclosure, I'm a senior advisor at the Validation Institute, just so you know. But that's an easy way to find these organizations. Most companies have no idea that there are businesses like this out there that their role is to protect employers from supply side vendors and help them navigate this very treacherous landscape called healthcare.
So you mentioned already that on November 12th your book comes out. Turns out today is November 12th, so your book just came out today. I want to dig in a little bit about that. Tell me about your book, and I'm sure there's people out there that are going to be need to be reading this. It's where for some of these businesses, reading a book is going to save you millions of dollars. So tell me a bit about your book that came out today.
Yeah, so my book is called Fixing Healthcare: How Executives Can Save Their People, Their Business, and the Economy. Again, this is a $300 billion annual opportunity that here's the thing, we don't need any action or permission from Washington D.C. to reclaim this lost profit. Business executives have the power right now. They just haven't had the clarity on how to leverage that power. So what I do in the book is I provide the history of the industry, how these different, vendors came to be, what their roles and responsibilities are, and provide a 6-step process for how you could actually use the power that you already have and reclaim this lost profit and help your people by doing that. You actually have a lot of employers don't realize this. They're actually under federal law, they are the fiduciary. It's not the insurance company. You, the CFOs, you guys are the fiduciary, okay? And you can actually be held personally liable for wasting money and buying ineffectively in this area. So it's good for business, it's good for you, it's good for your reputation to actually engage in this area and solve these problems. So I wrote this book because very few people talk about the landscape itself and provide a process for actually reclaiming this lost profit. So, it's really intended for people that aren't so technically savvy in this area. That's how I wrote it. I wrote it for CFOs, specifically at mid-sized businesses who don't have in-house teams and they're just struggling. They're constantly relying on the fox to guard their henhouse, and it's frustrating to them. So the goal of the book is to take healthcare frustration and transform it into a strategic advantage.
And so where can they find the book if they want to read it today? They're going, yep, I need, and I'll put it in the show notes as well below.
Great. So yeah, it's on Amazon. It's on all the channels. I mean, we just hit bestseller status this morning, and so yeah, go find it. If you don't have any time, go to fixinghealthcare.com and download a free executive copy summary of the book. Okay, you can get the key takeaways in a few minutes. For employees that are listening in who are sick of rising healthcare costs and stagnant wages, I'd encourage you to do the same thing. Go to fixinghealthcare.com, download the free executive summary, and give it to your boss. Okay. They're the ones that have the power to actually do something. And so they have a fiduciary responsibility to do it. And let me tell you, Blaine, you were around when these lawsuits came out on the retirement side of the business 20 years ago when you know the fiduciary standards started being applied and enforced on the retirement side of the benefits industry. That completely transformed that industry because it forced financial advisors to stop selling products for commissions and start selling services for a fee. And look what that did. It dramatically improved the performance of these retirement plans. That's exactly what's going to happen in the next few years on the health and welfare side of the business. These lawsuits have already started. Some of the law firms are the same ones that were around 20 years ago on the retirement side. So they know how to do this stuff. And so it's just a matter of time before you switch. But you can gain first mover advantage by acting now. So I'd encourage you to do that.
And imagine what could happen when you can redistribute what would be about 75 billion in savings or whatever that was. That's a lot of money injected into the economy and not just into insurance companies' pockets, right?
Exactly. I mean, let's face it. Anyone who looks at the stock performance of publicly traded insurers since the Affordable Care Act was implemented in 2014, it is breathtaking. That's where the money's going. It's not. Listen, your primary care physician, they make 27 cents on the dollar. It's not going to them, and it's not fair to them.
So Donovan, if a CFO is looking for some help on this. How do they get hold of you if they want to chat with you about this?
Sure. Go to my firm's website. It's healthcompassconsulting.com and take the free assessment. Take the assessment. See, in a few minutes, you can see how you're performing compared to your peers in the 7 categories of benefits value. From there, you'll be invited to book in a meeting with me and my team so we can review your results and see where the opportunities are for your organization.
Well, thanks so much, Donovan. This was a really enlightening conversation. Very, very interesting. I learned a lot today, and it's amazing how much money is up for grabs for businesses. And of course, businesses right now being in the cash flow industry, everyone needs a little bit of extra money. And if you're a CFO and you guys are buried in spreadsheets, you and your finance team trying to figure out where you're headed as a business, what your cash flow looks like, come and talk with us at dryrun.com. We're going to save you a ton of time, really clear visualizations for your management team, and make sure your data is accurate and right up to date. Thanks so much, Donovan. Really appreciate it.
Thank you, Blaine.